Hi, I'm Dr. Evan Matthews. I'm here today to talk to you about pre-exercise evaluation. So this is what you would do when you get a new client as a fitness professional. So there are a couple textbooks I want to highlight here that we're probably going to be pulling some tables and figures and looking at them. So you're going to need the textbook in order to see the figures because I don't post them in the videos. So one of those textbooks is the ACSM, so the American College of Sports Medicine's. They're resources for the Exercise Physiologist, second edition. If you scan this QR code, it's going to take you to a website talking about that book so you can find out where you can buy it. And specifically, we're looking at chapters 2 and 4. The other textbook is the ACSM Guidelines for Exercise Testing and Prescription, 10th edition. Again, you can scan the QR code, and we're talking about chapters 2 and 3 from that textbook. In the sequence of events that I've been recommending for exercise prescription, we are now talking about this set of 3 here. So number 3, 4, and 5, informed consent, health history or medical history, and the risk assessment and screening parts of the pre-exercise testing and prescription. The first one of those that I want to talk about is the informed consent. So you can see a version of an informed consent document here. This is actually what we use in our lab at Montclair State University in the exercise science lab. And for all of our students who are filling this out in order to participate in our classes. And basically what it is, it's something telling the student that there are some risks associated with some of the activities that we do, and that they need to be aware of those risks, ask questions about those risks, and be essentially an informed consumer of our product, which is the education. All right, so let's talk about informed consent a little bit more here. So it's something that needs to be done before doing any activity that has risks associated, even if that's a mild risk, even if that's a risk to their social status, their money, to their health, and regardless of what kind of risk it is, it needs to happen before the risk occurs. There needs to be some different parts to it. So first one is the purpose of the test is what I have here. So the purpose of whatever it is you're doing needs to be listed there. The benefits of whatever it is you're doing needs to be listed. And obviously the risks of whatever it is that you're doing needs to be listed. The next one here, the participant responsibilities. So this is you telling the client or the participant to let you know whatever it is that you need to know in order to do the job, to do it safely and effectively. All right, so they need to give you appropriate medical information about themselves, so the medical history. They need to tell you about their medication uses. They need to tell you if they have any symptoms during, before, or after the tests. Anything that would alert you to a medical emergency. So you need to let them know what their responsibilities during the test or during whatever it is, so that this can be done in a very safe way. And there needs to be a statement that all questions have been answered and the participant understands what's going to happen. So again, in the test or the activity or the class or whatever is going on. So they need to acknowledge that they understand, and you're going to have them eventually sign it. All right. So it has to say that their questions were answered, and they need to be actually given a chance to have their questions answered. And it's best if these informed consents are done both as a written document, so you have written evidence that it was done, as well as an oral format, so that they feel comfortable asking questions and they have a chance to ask questions. But they definitely need to be able to ask questions, and you need to do your best to answer them. A statement regarding the information and the privacy or confidentiality, if there is any. If you're collecting medical history on people, there is some sensitive information on that. You need to tell them that their information is not going to be shared and it's going to be kept private. There needs to be a statement that it is a voluntary test or activity that they are participating in, which basically means they can stop at any point in time, and they need to know that they can stop and they are in control at all times. And if they stop, it's not going to have negative consequences on them beyond what is required. So like, for instance, if you need to test them, do a certain test before they're allowed to enter a class or something like that, obviously if they don't do the test, they can't enter the class. But they're not going to have any negative consequences regarding like your social interaction with them or their job or their social standing, whatever you can assure them isn't going to happen. If they choose not to do the test or the activity, you need to assure them that it's going to be okay if they choose not to do it. And as I mentioned before, there needs to be a signature section. Typically there's a signature section for them, so sign and dates. there's one for you or whoever's doing the consenting, and sometimes there's one for a witness. That's not always the case though. All right, so an informed consent informs the client of the inherent risk of whatever the activity that you're doing. So if you're having them get on a treadmill and do a treadmill activity, that means they need to know that there's a chance they can get hurt on the treadmill. They can maybe have a heart attack because of the activity they're doing on the treadmill. If they do have something like a heart attack, they can even have consequences as severe as death. So that needs to be listed on there so that they know that is a possibility. It might be a very minute possibility, but it is a possibility, and they need to know that it is one of the risks. A couple notes here. A consent form is not a waiver. All right, so a waiver form basically tells the person if they sign it, they are waiving any liability that you could possibly have, even if you are potentially negligent in what you do. A consent form should never have a waiver line in it, so it should never talk about how you are not liable for things. That's a completely different form. It doesn't belong on a consent form, and it makes the consent form less credible. So make sure that you don't have a waiver statement on the consent form. If you're going to do a waiver, it should be its own form separate from the consent. If you're doing waivers, if you're doing consents, if you're doing both, they're definitely helpful. They're things you should do so that there's documentation of what's going on and that they know what's going on, they know the risks. But keep in mind, they're not fail-safes. Even if you have all the documentation in the world saying, oh, they won't sue me, they still have the ability to sue you if something goes wrong. It just hurts their case a little bit, but it doesn't mean they can't win the case still. So make sure that you're still doing everything appropriately and being as safe as you can. All right, so when it comes to exercise and the risks with exercise, again, most of what we're talking about is exercise testing, or what's happening once it's been prescribed and they just do the exercise prescription. The major risks are going to be cardiovascular events, so heart attack, stroke, things like that. And if somebody has that, it can lead to death. And they might have undiagnosed disease that they and you don't know about. And there's no way of anybody knowing about, and that could be aggravated by the activity. So it can cause some sort of negative consequence up to death. So make sure that they are aware of that. The other major risk is orthopedic injuries. So, they maybe get a shin splint, they get a stress fracture. If they trip and they, break their wrist when they try to catch themselves on a treadmill or something, orthopedic injuries happen with exercise. It's just part of our field. And so that it's not as severe a risk typically as cardiovascular events, but it is a risk that you and your client need to be aware of. Before you work with a client, have them doing anything, once you've consented them, done any of the waivers, any of that kind of stuff that you're going to do, you need to start getting their medical history. So you need to know what their medical history is. There's a document called a PARQ Plus that I recommend that you use. This is something that ACSM also recommends. You can do this, and you can do more advanced medical histories, or you can do a more advanced medical history, as long as it encompasses all the major topics like the PARQ Plus does. So quick note, the PARQ Plus is a sort of a newer form of this type of document. There used to be something called a PARQ without the plus. It was a much shorter document. There are some similarities to it, but it wasn't nearly as good a document as the PARQ Plus. And so you really should try your best to switch to the PARQ Plus if you've been using the PARQ. All right, so basically, though, it is a self-assessment tool for them to find out by filling it out whether or not they need to seek medical clearance before participating. And of course, you should look over it and tell them if you think they need medical clearance as well. And one thing to note, though, again, the PARQ Plus is a more advanced version of the PARQ. All right. And so for some people, it might be too advanced, and you might need to help them fill it out, where the PARQ is pretty simple. Most people could fill it out on their own. All right, so the good thing about the PARQ Plus is it is evidence-based, where the PARQ was not, meaning they've done some research, they've determined that it does help catch scenarios where it might be unsafe for people to exercise. If you want to learn a little more about that, here's a link to an article that talks about the evidence behind the PARQ Plus, and if you want to use your phone, you can scan this QR code and it'll show you that article as well. because you're going to be talking about medical history and collecting people's medical history, you need to be a little bit aware of the sensitivities around some of the privacy with that. So HIPAA is something we're going to be discussing soon, but let's show you the ParQ Plus in a little more detail here. This is one of the slides where you need to go to the source and look it up. I'll be talking about the ParQ Plus here, and I'm looking at it, but you need to bring it up on your computer and look at it too. There's a QR code on the screen here that you can look at, and that will, if you scan that, it'll take you to the ParQ Plus, so you can look at the same thing I'm looking at. So the first 7 questions here are pretty similar to the original ParQ, and basically if they answer no to all those questions, they can stop filling out the form. They can stop right there. They don't need to fill out the next 3 pages. If they answer yes to any of these, those are red flags, things you need to look at, and it forces them to fill out the page 2, the page 3, or the page 4, or all 4 of the pages. All right, so make sure that you look through this with them and you're both on the same page, and you know whether or not they need to go get more medical clearance in order to exercise. And we'll talk more about some of that later on in this section as well. All right, so let's talk about HIPAA now. All right, so first of all, here is a website, and here's the QR code to that website that gives you a little information about laws like HIPAA, the Declaration of Helsinki, some others that protect privacy of individuals participating in exercise or a research study or whatever. All right, so HIPAA stands for the Health Insurance Portability and Accountability Act. All right, so it's important for you to note that HIPAA does a lot more than just privacy, and most of the things that it does have nothing to do with our field. It's more for medical offices and hospitals in our field. In fact, most of our fitness centers and the places we're going to work as exercise professionals aren't even what they call a covered entity, which means HIPAA doesn't actually apply to us. We don't actually have to follow HIPAA. However, we're talking about HIPAA because some of the places you might work, especially if you're in some sort of medical office, you will have to follow HIPAA. And for the rest of us that don't have to follow HIPAA, it's still a pretty good guideline of some of the things that we should and should not do with people's personal information. All right, so again, most fitness centers are not covered entities, meaning they don't have to follow HIPAA, but some are. You need to find out whether you are at a covered entity or not. And I will say there's a lot of gray area to this. So HIPAA helps to define what protected health information is. And protected health information is basically anything that can be used to identify a person. All right, so their name, their address, their birthday, the various contact information, so the email, phone number, those sorts of things. Those are all very obvious. Full face pictures, which is why you oftentimes see people sort of cutting out around the eyes, so it's not a full face photo anymore. Any sort of personal identifying numbers, social security number, anything like that, those are all identifiers. So if you have that information, you need to keep it in some sort of secure place, a locked cabinet. If it's a digital document on a computer, then it should be probably password protected or kept in a folder on the computer that is password protected. And only the people who need access to it should have access to this information. This is not something that should be shared. This isn't something you share with your coworkers that don't necessarily need it. You don't give it out to other patrons of your facility. You don't give it out to your friends. You don't talk about it with your partner. You don't talk about it with anybody. This is something that's between you and your client, and that's it. All right, so let's go back and talk more about sort of the process here of bringing in a new client. So we're going to go through a list of objectives. All right, this one that we're talking about now is the first objective. We're going to get through, I believe I have 7 objectives here listed, but when we get further down the list, that means it's slightly less important. They're all important. You should do all of these, but the higher it is on the list, so the closer it is to number 1, the more important it is and the more of an issue it is if you kind of overlook some of this information. All right, so objective 1 here is to screen the person for previously diagnosed chronic diseases. And the big diseases that we need to be aware of are cardiovascular diseases, metabolic diseases, and renal or kidney diseases. All right, so the cardiovascular diseases, we're talking about peripheral arterial disease, previous heart attacks, strokes, things like that. Metabolic diseases, we're talking about diabetes, various liver disorders, thyroid disorders, hyperthyroidism, hypothyroidism, those sorts of diseases. For the renal or kidney diseases, chronic kidney disease, there's some others out there, maybe big kidney stones, different things like that. So these are diseases that can affect the safety of the person during the exercise. A lot of these are going to increase the risk of having something like a heart attack or stroke. And so that's the reason why you need to look for them and make sure that you find them if they are there. So some other diseases that you should take note of that aren't quite this level are the pulmonary diseases. So things like COPD, cystic fibrosis, interstitial lung disease, asthma. These are important diseases to know and know how to prescribe exercise for that person based on their disease, but they don't increase the risk of having like a heart attack or stroke during or immediately after exercise. So if the ACSM no longer recommends us having them elevated to this level, these other disease categories where we flag them right away and basically force them to get medical clearance. All right, so that's objective 1. Objective 2 is to identify the signs and symptoms that are suggested of disease that is undiagnosed. All right, so basically the signs and symptoms of those same diseases we just talked about. If somebody says they don't have a disease, you need to look for the signs and symptoms to see if maybe they do and just don't know it yet. All right, so the information I'm going to be talking about here is in table 2.1 in the exercise prescription and guidelines for exercise testing prescription 10th edition. So make sure that you get this book out right now and look over this with me. If again you're trying to figure out what book I'm talking about, you can scan the QR code and it will show you the book I am talking about. All right, so I'm just going to scan over this because you have the textbook in front of you and you should be looking at the table again, table 2.1. All right, so these are major signs and symptoms that the person probably has some sort of cardiovascular disease or some sort of issue where it's going to affect their heart's ability to get blood around the body. That's what all these signs and symptoms are basically of, is inability to pump blood around the body properly. So pain or discomfort in the chest, angina, things that we typically associate with like a heart attack. Shortness of breath with rest or mild exertion. So this is a sign that somebody is not getting enough oxygen around the body, so not enough blood around the body. Dizziness or syncope. Syncope is just a fancy word for blacking out. So they have a history of blacking out and passing out. So if they're dizzy or they have a history of blacking out, that means they are probably not getting enough blood flow to the body again. Typically, this is not enough blood flow to the brain. That's why they're blacking out. Orthopnea or paroxysmal nocturnal dyspnea. We're talking now about, again, shortness of breath, specifically when you're laying down or if you're sleeping. All right, so if you lay down or you sleep, or your client lays down or sleeps and they start having trouble breathing and they get short of breath and maybe they wake up a lot, gasping for air, those are signs and symptoms that they're not getting enough blood around the body as well. Continue on here, we have ankle edema. So that's basically extreme swelling around the ankles. It maybe can be to the point of pitting edema where you like push on the skin. And when I push on my hand here and I let go, my hand springs back immediately. That's normal. That should happen in the ankles too. If you push into your ankle or your client's ankle and there's just like a dent there that takes a few seconds to come back, that's pitting edema, which is a more severe form of edema. But any kind of ankle edema is a sign that the blood is getting congested in your periphery. It's getting down to your legs and then just kind of getting stuck there. It's not coming back, and so it's causing swelling. So again, that's a cardiovascular issue potentially. Palpitations or tachycardia. So palpitations is when you get that sort of fluttering in your chest, or when your heart beats a little weird. Really what it is it's typically a premature ventricular contraction. And so tachycardia is just really fast heartbeats. So it's some sort of irregular heartbeat that we're talking about here. Irregular heartbeats, if they're happening frequently, can potentially cause a decrease in blood flow out of the heart, which again affects blood flow around the body. So all this is about whether or not you're getting enough blood flow around the body. These are all signs and symptoms suggesting that you're not. Intermittent claudication. So intermittent claudication is actually a sign for peripheral arterial disease, or PAD. Basically what it is let's say you get on a treadmill and you walk at 3 miles an hour, you're fine. You ramp it up to maybe 3.5 miles per hour and you start getting these cramps in your calf muscles. That's usually where it happens in the calf, but it can happen in other places too. So that cramping, that's claudication, so intermittent claudication. So it's a sign that you have some narrowed blood vessels in your legs. If it's happening in your legs, if it's happening somewhere else, it's potentially narrowed blood vessels in those places, but it's a very predictable cramp. All right, so every time you go up to 3.5 miles an hour, you get the cramp. You slow back down after a minute or two, the cramp goes away. You go back up to 3.5 miles an hour, you get the cramp again. It's not an exercise intensity that causes you to be exhausted and that would cause cramps in a normal person. We're talking about a light amount of exercise and causes a very predictable cramp in a single muscle or muscle group. It can happen on both sides of the body, but it's a predictable cramp that always happens at the same intensity. That's intermittent claudication, basically. So again, it's a sign of PAD, which is a vascular disease. Known heart murmur. All right, so heart murmur basically means that your valves aren't opening and closing properly and keeping the blood going in one direction only. And so if you have a known heart murmur, this can cause an inability of your body to get enough blood flow around because, again, blood's going the wrong way in your heart. And so that's something that needs to be checked out. Unusual fatigue, shortness of breath with usual activities. So your entire life, you've probably been sedentary, most people have been, and you've gotten up and down the steps just fine. Then suddenly you start having difficulties getting up your steps. Every time you walk up your steps, you get really out of breath to the point where it seems a little off-putting and you think there might be something going on. That's the kind of out of breath we're talking about here. So again, unusual fatigue and shortness of breath with normal activities that you've always done. All right, so these are, again, all signs and symptoms that there might be some sort of cardiovascular disease happening, and these are signs and symptoms that you should definitely bring up and have them go to their doctor and get checked out, and you probably shouldn't be working with them, or not probably, you should not be working with them until they do get them checked out. All right, so we started with known disease, then we looked for signs and symptoms of disease. Now into the third objective, now we are looking at the sort of health history of the person to assess for risk factors that can lead to disease. All right, so you can see how we're going sort of down in the severity. So we had known disease, potentially have disease, and now maybe someday you'll get disease. That's what a risk factor means. All right, so this is another slide where you're going to want to pull up your textbook for, because there's a table here that I'm going to be looking at, and you're going to want to open it to that table. We're talking about table 3.1, and again, the exercise testing guidelines book from the ACSM. Here is that QR code, again, if you're trying to figure out what book I'm talking about. All right, so with risk factor assessment, there's been a lot of changes with how we do this and the recommendations from the ACSM in recent years. I'm not going to talk about the way it used to be done because I think it just confuses people. But if you've learned this before, just know there's a lot of changes here and you should learn the new methods, kind of like what I'm going to be talking about here right now. All right, so these risk factors are the ones that you want to note, and these are the ones that are going to increase the chance of some sort of cardiovascular disease or cardiovascular event in that person in the future. All right, so their age is a risk factor. So for men, equal to or greater than 45 years of age. For women, equal to or greater than 55 years of age. Having a family history of myocardial infarction or some other sort of cardiovascular disease. And there's some age limitations on that. I'll let you look at that on your own in the table. All right, so cigarette smoking. So does the person smoke? Have they smoked in the last 6 months? Or are they a current smoker? That's a risk factor as well. Physical inactivity. So do they exercise as they should or do they not? Are they sedentary? If they're sedentary, that's a risk factor for cardiovascular disease. Are they obese? All right, so there's some different classifications here. The one that we've already talked about a lot in the previous lectures here was a body mass index greater than 30 or equal to or greater than 30. But there's some other classifications that they use in order to classify as obese. Again, look at your textbook so you can see those. Hypertension. So this is one that, to be quite honest, I'm a little unsure of how to treat at the moment or deal with at the moment, because the hypertension guidelines have changed recently, at least according to the American Heart Association. So the American Heart Association lowered the classification of hypertension down to 130 over 80 millimeters of mercury. So 130 systolic, 80 for diastolic blood pressure. All right, so the guidelines textbook that we're referring to here from the ACSM was released before that happened. So whether or not they are going to move with the AHA or stick with the original threshold for hypertension, which was 140 over 90, I don't know. I actually tried to email them and they did not get back to me on that. So most likely they are going to change, I would assume, to the AHA's recommendations. So again, hypertension is defined as a systolic blood pressure over 130 and or a diastolic blood pressure over 80 millimeters of mercury. So if either of those are there, they have hypertension. And there's some other nuances to that. It has to be done at 2 different times, and these are things that have to be tested by a medical professional, not someone like us who's just sort of a suspectician. We don't actually diagnose people. But if somebody has hypertension, that's a risk factor. Dyslipidemia, so this is something out of whack with their cholesterol or triglycerides in their blood. So basically their blood cholesterol or triglyceride levels are too high in some way. And we're talking specifically about the bad cholesterol here, and I'll let you read the guidelines in the table yourself and what those thresholds are. Diabetes. So if a person has diabetes, so basically if their fasting blood glucose is higher than it should, they are typically considered a diabetic, and that is a risk factor for cardiovascular disease. There is one negative risk factor. So all those were positive risk factors, which is actually a bad thing. So positive risk factors meaning that it increases the likelihood of having a cardiovascular event. There's one negative risk factor. It actually decreases the likelihood of having a cardiovascular event. And that is having a high density lipoprotein, so HDL cholesterol level that is equal to or greater than 60. All right, so if it's equal to or greater than 60, that's a negative risk factor, which is a good thing. Okay. One thing that is often done is these risk factors are tallied up. So I just talked about 9 different risk factors. One of those was a negative risk factor, so it actually removes a risk factor. So let's say you have all of them, that gives you 7. So you have 7 risk factors, not 9. All right, so again, you add up the positive ones and you subtract the one negative one if they have it. And so whatever number you get, you can then determine the risk of getting cardiovascular disease in the future based on this. Now, it's just an estimate of risk. It doesn't mean they shouldn't exercise. In fact, they probably should exercise, and that's some of the major changes that happened recently. But again, we're not going to go into that. But let's look at this table real quick. If somebody has a 0 to 1 tally on their risk factors, but has a sign or symptoms of disease or a previously diagnosed disease, they're automatically high risk for the possibility of having cardiovascular disease. If they have 2 or more risk factors and they do not have a sign or symptom, they have a moderate risk of developing disease. If they do have a risk factor, again, they're automatically high risk. So, if they have a sign or symptom or diagnosed disease, they're automatically high risk. So, in either scenario, no matter how many risk factors they have, if they have signs, symptoms, or diagnosed disease, they're automatically high risk. All right, so the fourth objective now. So we've gone through risk factors. Now we're getting into their medications. So review their over-the-counter and prescription medications as well as their nutritional supplements. And this gives you a lot of good information. One, it's going to give you an idea of what might happen if you exercise them, because some medications can actually interact with exercise in some negative way and make a dangerous situation. It's also going to give you a second chance to try to figure out if they have some sort of disease that they didn't tell you about. A lot of times you'll see somebody on, say, like a high blood pressure medication, but they didn't tell you they had high blood pressure on their medical history because it's in control. They don't have high blood pressure anymore, but it's not that they don't have it. They're just medicated, so it's not showing up when you take a blood pressure measurement on them. If they are medicated for something, they do have it. So whether it's normalized with the medication or not, they have that symptom or that syndrome, that disease, that whatever. So this is another way that you can potentially check to see if they have something that they haven't told you about yet, because a lot of times that's going to happen. They're not going to tell you, and you're going to see the medication for it. All right, so Become familiar with the purpose of their medication so that you can have an idea of their conditions as well as how it's going to interact with exercise. So if they're on a medication that you're not aware of, look it up, see what it's for, see what it does. Talk to them, ask them what all their medications are for and what they do, and find out what the timing of that medication is. So when do they take it? So especially with like a diabetic, you want to know when they take their insulin, because it's going to affect when they can exercise safely and how much exercise, the type of exercise they can do. Make sure that you tell them if anything changes with their medicines that they have to let you know. It's very important if they change their medications that you are made aware, because again, it can affect their tolerance to exercise safely, and you want to make sure you know that. So it's not just the prescribed medications, it's the over-the-counter medications and the nutritional supplements. Some of them can have some pretty crazy side effects, especially those nutritional supplements, because they're not regulated as well as medications are. And so you need to know those and what the possible side effects are and how that might affect their ability to exercise safely. So make sure you're looking into all this, talking with them and looking things up. Again, you're not telling them what to take and not to take. That's outside your scope of practice, but you need to understand the risks of what they're taking with exercise. All right, so the fifth objective here is to review their past history of orthopedic injuries. So we're talking bone breaks, sprains, muscle tears, that kind of stuff. And so obviously, if somebody has a previous injury, you want to make sure you know, is it healed all the way? Do they have any limitations from that injury? Or are they able to exercise normally? Do you need to make sure you stretch them a little extra in order to prevent an injury from reoccurring? Whatever it is, you need to be aware of it. You need to adapt their exercise prescription for their past injuries, because somebody, once they have an injury, it's probably going to be something that's going to come back sometime in the future. Next objective, the sixth objective here, is to determine their level of physical activity. So do they exercise regularly? If so, what's the duration, the intensity, the frequency of their exercise? All that's going to help you determine what you can do with them safely, because you want to know where their starting point is so that you can progress them slowly and effectively. You don't want to start them too low if they're exercising already, and you also don't want to ramp them up way too much and get them hurt or sick or so sore that they end up quitting on you and you lose a client. So make sure that you know about their current and previous physical activity. And also, during this is a good time to ask them what their interests are in exercise. Do they hate the treadmill but love the bike, or hate the bike but love swimming? Maybe they don't like aerobic exercise at all and prefer to just kind of do it on their own, just walking their dog, but they love resistance training, and that's what they want to work on with you. You want to ask them what their interests are and what their goals are, and this is a good place to do that. So the seventh and the last objective that you need to do is to determine whether or not they need medical clearance or physician's clearance. So there is a decision tree that we're going to talk about on the next slide here from the ACSM, but let's just talk about this in a little general perspective for a moment. So do you need clearance prior to engaging them in exercise? Yes or no? That's really the question you're after. And so that's before you do any exercise testing and before you do exercise prescription, working with them on a regular basis. So do not test people until you know if they need medical clearance. All right, so also you need to know what intensity of exercise they can participate in safely. So can they do light exercise only? Can they go up to moderate? Can they already go up to vigorous intensity exercise? What intensity is safe for them? You need to know that, and you can only know that by going through the process we're about to talk about. Also, do you need to refer them to any medical other persons other than their medical doctor or nurse or something? Maybe they need to see a dietitian, a psychologist, a physical therapist, a chiropractor. There's lots of people in the medical field that aren't just their immediate physician that they might need to see before they can work with you effectively. Maybe they have an old injury that they went to a physical therapist for, and the injury is kind of acting up a little bit because they stopped the exercises, and a couple months later it comes back. So you need to get them to go back to their physical therapist and to get that reevaluated and get them back on track with that injury or whatever. Are they severely overweight and obese? Maybe you should have them see a dietitian. Do you suspect that maybe they have an eating disorder? You'd want them to see some sort of psychologist. And so you need to make sure that you look through their information and you assess that and find out if they need it, and then refer them to the proper professional, because again, all those things are outside of our scope of practice as an exercise scientist. All right, so the decision tree for determining whether or not somebody can exercise without medical clearance and what intensity level is what we're going to be talking about now. And this is from the ACSM. If you scan this QR code, it's going to take you to the version of the decision tree that is published and available online for free. It's also in the ACSM guidelines textbook that we've been talking about. But I'll be honest, I don't really like the version that's in the textbook because it only shows kind of part of it, and it's a little confusing to me, at least in the way that my version of the textbook, I have an early edition, or an early version of the 10th edition, so maybe they've gotten it better. But regardless, if you scan this QR code or go to this link, you'll be able to see the same document that I'm looking at right now and that I'm going to be talking about. All right, so question number one, the most important question: do they participate in physical exercise right now? Yes or no? And specifically, you want to know if they do it at the level that we consider exercise. So if you look back at the risk factors list, you'll see what the level I'm talking about. Basically, we're talking about at least 3 to 5 days per week of at least 20 to say 30 minutes, depending on moderate or vigorous intensity exercise. So do they participate in enough physical activity or enough exercise in order to be considered healthy and low risk? So based on that risk factor. All right, so if they don't participate in physical activity and the answer is no, then you go down the decision tree in that direction. And so then you need to ask, do they have any signs and symptoms of cardiovascular disease? If the answer is no, then they probably don't need medical clearance and they can exercise at a light to moderate intensity exercise right now without seeing their doctor. If they have known diseases, but they're asymptomatic, means they have no signs or symptoms and their disease is well maintained by their medications or whatever it is that they're on by their doctor, then they should probably get medical clearance still. But once they're medically cleared, they can probably exercise at a light to moderate intensity exercise safely. But again, you still need that medical clearance because they have known disease. If they have signs or symptoms of disease that is suggestive of cardiovascular, metabolic, renal disease, then but the disease status is unclear, regardless if it's been previously diagnosed or if it's something that they haven't been diagnosed for, then they're going to need medical clearance. You definitely should not let them exercise. And if they are cleared, you want to start them probably at a light to moderate intensity exercise based on whatever their physician or their medical personnel told them. All right, so those are the no branches of the tree for exercise. If they do exercise, going down the yes branches of this tree, so let's say they have no known disease, they have no signs or symptoms of disease, then they don't need medical clearance and they can continue to exercise because they've already been exercising. They can continue to exercise at a moderate or even vigorous intensity exercise intensity if that is something that they've already been doing. So let's say they're exercising at moderate intensity, that means you can slowly progress them to vigorous. If they've been exercising at a vigorous intensity, you can just keep them going at a vigorous intensity. All right, so again, if you do exercise, but you now you have known disease, but are asymptomatic, meaning you don't have any symptoms of the disease. If they want to do moderate intensity exercise, again, they exercise, they have a known disease that's under control and no symptoms of the disease, no symptoms of other diseases either. That means they've already been medically cleared at some point in the past, probably. And so they can probably exercise at a moderate intensity, but they really should have had medical clearance at some point. And if it hasn't been recent, that being in the last year or so, then you probably should have them get medical clearance anyways. If they want to exercise at an intensity higher than moderate intensity, make sure that their medical clearance is recent and that it says they are allowed to exercise at a vigorous intensity. All right, so the last branch here, again, they do exercise regularly, but they have signs and some symptoms suggestive of disease, whether it's a diagnosed disease that's just out of control or an undiagnosed disease. You need to not exercise them and actually tell them they need to stop exercising on their own as well. So they should discontinue their exercise routine and they need to go seek medical attention and can not exercise until they are medically cleared. All right, so this is, again, the decision tree for whether or not they need medical clearance, as well as the intensity of the exercise they're allowed to do with or without medical clearance. All right, so if you have any questions about any of the stuff I just went over, again, it was a very brief overview. There's certainly more information out there that you could gain, but feel free to put the questions below and I'll try to answer those. Otherwise, please come back and watch another video. Thanks.